Carrie here from Wrap Your Head Around Silks, and welcome to the Expecting Areolus podcast. Today we have Dr. April Douglas, our resident physical therapist and pelvic floor dysfunction specialist, and we're going to have her here for many other podcasts, but today we're going to talk about Diastasis Recti. I'm saying it so wrong. I'm just going to call it DR from now on because every single time I try to say it, it comes out wrong. So we're going to talk about this phenomenon where when your belly grows, your abs open up through the center line to make room for the baby. And it makes total sense, but for us athletic women and for women in general, it's like a 4-letter word, getting those abs to split open because we got to sew them back together somehow. So I'm going to ask her all the questions that I feel are going to be the questions that are going to come out of your mouths, hopefully. How it happens in the first place, when to start trying to treat it, and how to treat it. And all of this is going to be new news to me because I myself, I never had a separation of my abs to begin with. I always remembered as a teenager looking at my friends and they'd have these 6-pack abs. And for me, I just, like, it wasn't a bad thing, but I just had like flat. And I didn't really understand why they felt like they had all of this, like 6-packness, and I didn't. And then recently, I had my baby and I realized, I probably won't get as bad of DR because especially towards the top of my abs, there's just no separation at all. And then lo and behold, after, I'm in my 3rd trimester and I do have some splitting happening, but it's at my belly button. So for me, it's not so much because I kind of knew like I wasn't going to have a lot of separation because in the first place, I don't have separation right there. But for a lot of women, it's really problematic. And I'm going to ask April all the questions and she's going to hopefully have some great insight for us. So without further ado, here is my interview with April. April, welcome to the podcast.
Thank you so much for having me.
So April is our resident physical therapist and pelvic floor specialist. She's going to be here every now and then to really give you guys a lot of information about some of these topics. And today we are going to talk about Diastasis Recti. Did I just say that right?
Oh yeah, it's one of those tomatoes. Diastasis or diastasis. Everyone says it differently.
Okay, and it actually means.
So it is a separation of the abdominal muscles. So the abdominal muscles attach at the linea alba, and the linea alba is a connective tissue, fascia, that goes down the midline of your abdomen. So when you see 6-packs on somebody, that little space in the middle is your linea alba, and all of your abs meet up there. It's technically an epineurosis. And so it's just connective tissue there. And diastasis recti is when that linea alba, usually, specifically, is stretched out, or it's a lot of people just call it ab separation. So the abs get further apart from each other.
Okay, and just to let my listeners know, my little bean is on my lap here, and she's going to be giving her commentary as well.
Special guest.
Because this is the only way we can schedule these things. So just for me, it's not just your 6-pack abs, the rectus abdominis. It's the fascia, it's the TA, it's everything.
Yes. So it's all combined in one.
Okay. And how do you diagnose Can I just call it DR for today's
Definitely.
podcast? Okay.
In our world, in our notes, so pelvic floor PT, we usually just write DR. So you've got it.
Awesome.
There's a little bit old school and new school thought process on this. So the traditional way that you do it, that you see online a lot as well, is you lay down on your back with your knees bent, hook line position, and you test all along the linea alba. So you start just below the end of your sternum, the xiphoid process, and you work your way down midline, but you put your fingers there and you ask the patient to kind of lift their head up, so like a little baby crunch, and you feel for that separation there. And then they lower their head, then you go down a little bit further on the linea alba, they lift their head, and then they go back down. So you keep continuing your way down to a little bit above the pubic bone. And what you're looking for with that traditional style is just how much of a separation, how many fingers can you fit when they lift their head up. And so what is normal is 2 fingers or less, or 2 centimeters or less. So keep in mind the size of your fingers. But a lot of people, even in research, excuse me, go off of just their fingers. But I personally have nerded out and measured my fingers, and they're a little
Oh,
bit
amazing.
than 2 centimeters. So things to consider. New school thought process is separation is, important to note, still test for it, but what's the tension like across the linea alba? So when they lift their head up, cool, you can feel that separation. How many fingers can you fit in there? But then also, does it feel like a valley where you can like keep going and it feels like you're going to touch their intestines or something?
Okay.
Or does it feel like a stream bed? Like it goes down a little bit, but there's some tension across there. So there's some tone. And so more new school thought process is like, cool, let's measure that separation, but how much can you load across the linea alba? Or does it feel like really weak and it's not like your fingers can just keep going and sinking?
Okay. And this makes me think of my own body because I've always had really tight fascia. So does that come into play too? The actual, just the person's body, if their fascia feels like tight across their entire body, or it's pretty watery and flexible.
Yeah. So with diastasis recti, stretch marks, all that fun stuff, anything with your skin, there's a lot of genetic contributors, a lot. And a lot of people think and have been told that, you can prevent it or heal it if you do it this one way. But there honestly just isn't a recipe for everyone because everyone's genetics are different. With the linea alba, what is unique about it with the tension across it is if you imagine the abs connect to this midline, if this doesn't really happen exactly like this, but if the right side pulls on this line, it's going to pull to the right. And if the left pulls, it pulls to the left. And if both activate, then it increases the tension across this string or the linea alba. And so that's what we're feeling for. So yes, there's the makeup of the fascia, genetics, and also sport and what you expose your body to. A lot of it is how much are you like pulling that fascia apart in either direction, therefore creating more tension.
Oh, I see. Okay. That is a small difference in what I thought. Okay. That is so interesting. And okay, so let's look at the different extremes of it. So a lot of people have what they call mom pooch. And so if you could talk about if the mom pooch is actually DR, and then on the other side, what's considered an extreme case of DR?
Yeah. So I guess we'll start with the extreme case because normal, I mentioned it earlier, is 2 centimeters or less. Some people argue that 2 centimeters or more is something to write about. So that 2 centimeters is kind of the fence, I guess. The most I've ever seen as far as separation goes is a 4-finger separation. Now, this was like fresh postpartum, so it definitely got a lot better. We got her down to 2 centimeter separation. Um, but the biggest thing is how much of a valley do you feel? So with that tension. So there are some people where there's hernias involved, and you have to see ideally a specialist, and then you kind of make decisions from there. Is it affecting you? Is it not affecting you? And those are big variables. So the extreme cases are when there's a big valley, it keeps sinking, there's no tension, and also hernias are involved as well. Um, and so that's when we pull in our team. So OBGYN is kind of in on it, mostly hernia specialists, sometimes plastic surgeons, but you want to just make sure that they're very familiar with what they're doing. There's some variations on the surgeries as well. So you just have to make sure that you do your research on who you see and who you don't see. Mom pooch. It can definitely be related to diastasis recti, but I don't think as much as the internet advertises. um,
Okay.
according to my Facebook ads, the mom pooch can be quite a few things. I think the largest contributor is that during pregnancy, that all of the fascia, the muscle, the skin, everything stretches. And so, again, based upon your genetic profile and what you are doing or not doing, that can greatly impact all of that. But, if you see people have lost a significant amount of weight, then their skin just looks a little bit different sometimes. And again, those are different journeys as well. And the same thing can happen with pregnancy. So, a lot, especially in the first phase of postpartum, like the first 6 months, a lot of women are sometimes okay with it, but start to edge on being upset about it. Where in the morning they'll look fantastic and they'll look like what they deem their pre-pregnancy body. And then by lunch or dinner time, it looks like they're pregnant again. And a lot of times,
Because the intestines fill up and then the body just kind of expands to where it expands to.
yes. So there isn't as much tension. That stuff has been stretched out a little bit. So
Okay.
some of that is, again, genetics, the size of your pregnancy. Did you have multiples? How far along did you make it? There's just so many variables there, but that's the largest one that I hear where some of that is, it gets a lot better with time. I'm 6 years out from my birth, and my skin and tension have definitely changed beyond the first year of postpartum.
So it's tight. You've tightened up just naturally
Yeah.
since then. Okay,
Yeah, and also just
that's good.
using your muscles differently, loading the tissues, working out, all that good stuff. And with at least my journey, that always ebbs and flows, especially with parenting. So, a lot of it is giving yourself a little bit of grace. But diastasis recti can have a large portion in that. So there's some women that come and see me and are just straight up like, tell me how to get a better stomach. Um,
Mhm.
and so some of that is C-section scar related. A lot of people have like this shelf that they always talk about. So there are things that you can do, but you also have to be prepared to hear that, you went through a pregnancy. It definitely changes your body a little bit. So
What do you mean?
I know
Shouldn't it
anyone
just
wants to hear
be?
it. I don't want to
No,
hear it.
I know. So how much is like the postpartum belly binding gonna help? And then do you do that like years after to help, or does it stop being beneficial after the first 6 months?
Yeah, so with belly binding, there's some cultural um, traditions in there as well. So I can't speak to those ones, but I can speak to just like general binders and stuff like that. Um, with a lot of times it's given to C-sections, those with C-sections, and advised like usually for about the first month, maybe 6 weeks. And it's usually best with activity, not just like hanging out. For some people, it makes them feel better. And so my policy is always, if it makes you feel better, go for it. But really, after that first month, I try to encourage to get rid of that thing ASAP.
Okay.
It's kind of like a brace anywhere in the body. First and foremost, we want your body to know that it can be very successful without it. Um, and also, we want to find strategies on how to get those muscles to activate properly without an assistance. So, if you need a little bit of assistance, there's nothing wrong with that. But for long term, no thanks. And then also, for date nights and stuff like that, there's a lot of people who wear Spanx, like, or something
Yes.
close to every day. And the pelvic floor world usually does not recommend that. But for date night, sure, whatever. It's kind of like stilettos. They're not good long term.
Right. But for
But,
the for the one night.
yeah, it doesn't allow you, a lot of the binding um, doesn't allow you to use your diaphragm very well. And your diaphragm is it's part of your core. So your core is made up your diaphragm, your transverse abdominis, so third layer of your abs, your pelvic floor, and then your multifidi, so deep, deep spinal muscle that you can't touch. And so the diaphragm, that breathing muscle, is a muscle. And so if we can't use it properly, it works um, reflexively with the pelvic floor. So if we are, jamming our stomach into something, then usually we can't breathe very well. So for us, it's very important to get out of that as soon as possible within your limits. So,
I didn't know that. And I also love breathing.
yes, breathing is very great.
Breathing is great. And Spanx are really uncomfortable. I'm not like I'm a really petite woman,
Mhm.
but I have like all these gastrointestinal issues. So every time I would use Spanx, I'd be like, this is terrible.
Yeah.
So April has given us all permission to get out of the Spanx. I love it.
Yep.
Okay.
Yeah. Yeah. They also like, I have little pooch here and there. So like it bunches up in that section. It's not,
I know.
it doesn't feel great.
Yeah, so get rid of the crutches and let's embrace our bodies type of thing. Let's get it
Yeah.
back into treating DR. So the next couple questions, you can kind of answer at once. So when should women start to treat postpartum? What are the treatment steps? How do you get the gap to close? Any way you want to answer that.
Yeah. So here's my little fantasy world. The ideally when we should start, I always recommend go see a pelvic floor PT when you're already pregnant. Um, a lot of times we can assist with, birthing positions. What is your pelvic floor doing? And also just kind of prep you for what's to come. And during those pregnancy visits too, we talk a lot about core and your diaphragm and how it all works together. And I usually give a little baby program for right after birth. So even just working on diaphragmatic breath, which grabs your pelvic floor and a little bit of your abs, you can start that pretty much right after birth. And it's just breathing, but it's breathing with certain intentions and also with your diaphragm. And most of us are walking around just doing chest breathing, short breaths. So you can start pretty much right away, but you need some guidance on that. Um, a lot of us push ourselves too hard and our expectations are really high. Or, you can go on the other end of the spectrum and everything hurts or you're nervous about it. Or so get an expert on your team to kind of help you out with all of that, because you don't have to feel that way, or you can feel that way, but at least get someone to help you lay it all out for you. So you can start really quickly. And you getting that gap to close, first and foremost, a lot of it is your body is rapidly changing, all within a year's time. So I tell a lot of my patients, don't forget you had 3 huge swings in 1 year. So pre-pregnancy, your pregnancy, and then postpartum. those are huge swings that you just don't see a lot outside of pregnancy. And so I try to compare it to kind of puberty. So a lot of times you're going to feel uncoordinated and your muscles aren't firing right. And so it helps to get a little sleuth on your team to figure out strategies for you to come back. And also, again, to give yourself some grace. Your body has had these huge swings. So getting that gap to close, some of that is time. So even the research is showing, so at about 35 weeks pregnancy, there's some research that has shown that 100% of pregnant people at 35 weeks have diastasis recti.
Oh, wow. Okay.
100%. Yeah. Now, there's other research that doesn't say the same, but that's kind of the newest thing, is you're kind of guaranteed to have some level of diastasis, or DR. And then at 6 months, the stats are kind of around 30 to 35% still have DR at 6 months postpartum. And so that's a huge difference of just 6 months going from 100 to 30 to 35%. So, and that's mostly time. So with physical therapy, our whole jam is like, well, let's make sure that you stay on that path and hopefully accelerate it for you, and give you some good strategies long term. So our whole job is to load that linea alba at whatever speed you are at. So whenever I do my assessments, I try and figure where your threshold is, basically where you start to fail. And then I work from there versus, everyone has a set program and you start on your back and then go to your hands and then, so I do a lot of that in my assessment. And then, so that way a lot of patients, I fast forward through a lot of the beginner stuff and now we're already lifting weights and you're good. And then there's others where like, okay, we need to start flat on our backs and then go from there. But most people, you kind of test out of that pretty quick. So it just depends on the phase. So I'm seeing some people 1 week out of birth. And so those ones I'm starting really simple. So yeah, that's a very long story.
No, it was really informative. It was great. Okay, so obviously our audience are a bunch of people who do aerial work, meaning that they probably have a bit of strength in a bit of strength going into their pregnancy, to varying degrees. How does the separation correlate to strength exactly? Is it more cosmetic, or does it exactly relate to how much strength you've lost or how much strength you have?
I don't think, have the full answer to this, because it used to be that we would correlate it with low back pain and incontinence and all this stuff. And a lot of the research that's coming out is saying that it's not correlated with those things. But I would argue that it's still maybe a factor in it, or maybe not a causation of those things, but maybe a factor. So, are your flat feet causing this, that knee pain? No, but maybe how we, maybe that strategy or that strength is affecting it on some level. So same thing with DR. We kind of consider it a factor of maybe your symptoms, but I wouldn't blame DR for everything, because it's not showing in isolation to be impacting those items, but maybe with other things, how you walk, how you load the rest of your body, how you move. With aerialists, which by the way are like my fangirl people, love aerialists. Anytime that you are more fit going into your pregnancy, there tends to be far better outcomes throughout pregnancy and in postpartum as well. With the athlete brain, this is the tough thing with athletes, is sometimes during pregnancy that athlete brain wants to stay at a high level instead of saying, because they can, but their strategies for maybe staying at that high level might be compromised. You're doing a lot of breath holding, compensating, it's not as smooth, all that kind of stuff. So with athletes, it's a little bit tough. during pregnancy phase because they can, so they do. And I'm
Mm-hmm.
sure aerialists are very used to pain and discomfort. So it's kind of like, what? What's the difference? So it's also kind of acknowledging, especially in the third trimester, of like, okay, we need to modify a lot of things to help make sure that my tissues are still being loaded and strengthened, but we're not compromising them. Then postpartum, again, with that athlete brain, a lot of times it's always the comparison to your best moments,
Mm-hmm.
instead of acknowledging that, hey, I actually am deconditioned a little bit. I had um, a surgery or a birth that's basically a surgery, and I need to kind of work from the ground up. So a lot of times I compare birth to an ACL surgery. An ACL surgery, you are not allowed to run for usually 9 months at least. Um, and you have really boring exercises in the beginning. And a lot of it's building your foundation up, working on that swelling. So it's just taking care of your body in the beginning and working on the foundation of your body. And so for a lot of athletes, it ends up working out great because we finally strengthened a foundation that they hadn't really worked on very much. They worked on more their big muscles. And they could muscle through a lot of things, but they couldn't hold those positions well, or it wasn't smooth, it wasn't coordinated. So sometimes it ends up working out way better for them in the end. It's just a lot of mental work for that athlete to be okay with that and to acknowledge that deconditioning and atrophy that they went through with that pregnancy and birth and healing. It's a tough go, but being an athlete generally always puts you in a better spot than someone who's not working out and loading their body. So
So what you're saying is that we need to be patient?
yes.
What an idea. I don't know what that means. None of
It's
us
really
do.
hard.
We like to ignore that and be like, I don't know, I feel like there's this underlying competition of like, oh, she got back so fast.
Oh, yes. And,
And we
athletes
all do it
do,
and we
yeah.
can't help it.
Oh, yeah. There's so much pressure on ourselves. And, and sometimes it's the company you work for and the state laws that you're in. We're in California and we're pretty lucky to get some extra time off usually. So than other states compared to the rest of the world, we're still a little behind. But it's acknowledging that healing time. So some of these, like closing DR, some of it is straight up time and allowing your body to heal and change shape again. And then, with athletes, sometimes there are some shortcuts too, um, as long as you're acknowledging the healing rate. A lot of my athletes get back just a lot faster. And also they have that muscle memory, that coordination.
Mhm.
And so it's quite wonderful from the physical therapy standpoint to watch and observe that. But it's really hard to like hold people back too. So some of our job is, making sure that you're on a healing path. And so a lot of my athletes are, on the weekends pushing themselves a little hard. And sometimes it's a good thing because we tested the waters. We checked out if it worked or not. And so sometimes it's still a good thing to, whoops, it's the acknowledgement of like, okay, that was a good idea or that was a bad idea.
So, back to the prenatal stage, can
Yeah.
you give me an example of some exercises that would help prevent, if it's possible, DR, or kind of go the other direction and possibly make it worse? Is that just a old wives' tale, or is that true that some would prevent and some would increase the likelihood?
It is, oh gosh, this is a tough question. It is, I would say, mostly an old wives' tale at this point, especially since the research is showing 100% at 35 weeks if you make it there. But I will say there's a lot of strategies and things that can help it from making it worse. Um, Again, with that athlete brain, are you able to get through the workout without holding your breath a lot? Is it smooth? Is it coordinated? Um, the biggest thing is holding the breath a lot and pushing out. So, are you pushing? A lot of that breath holding is typically pushing out. So, you're pushing out on your tummy and out on your pelvic floor. And so that's just stressing those tissues a little bit more. You're going to do it throughout the day randomly, but is that the only way you can get through your workout? Well, we probably need some new strategies. So you should be able to breathe through your workouts and breathe well through your workouts. It should be coordinated and smooth. And also, you need to acknowledge just how you feel. So a lot of times we push ourselves until you're like crawling out of the gym, and you're pregnant. So you should, get your workout in, but you should also be okay if of like, I don't feel very good, or I'm lightheaded, I'm done for the day, or what, I'm done for now and I'm going to go on a walk later. So sometimes it's modifying what activities you do. The third trimester, especially, I'm really into getting in the pool. It unweights the tummy and the spine. It usually just feels nice, and you can still do resistance work in there. Um, but it definitely unweights you a lot. I usually feel nice in the pool, provided it's a little heated. But yeah, it's more paying attention to how your body is functioning and making sure you give grace for that. But I think, like they used to say, sit-ups are bad for you. And that's all very dependent on the person. So when you do a sit up, does your belly stick way out? Is there a lot of doming? And you're having to hold your breath through the whole thing? Probably not a great exercise for you right now, but maybe later. So it depends.
So is that doming thing a good cue though to say, okay, I'm not going to do that exercise anymore?
Yeah,
That in that way?
I would say doming, just talking about general population, broad sweeping statement. So keep in mind there's going to be absolutely some nuances here, but doming is generally a good way to check in if things are going well or not. So is there, a dome that's coming out of that linea alba right down the center whenever you do an activity? That's usually a cue of like, woo, we can do a better strategy here. And then also, if you're holding your breath through a lot of things, then there's a better strategy for that. Or maybe it's too high level for you, or maybe just even for that day. So, doming is great, and breath holding is also a great way to check in.
So would you say, because I've, read a lot of blogs and they say, after a certain point in your pregnancy, no more planks and no more sit-ups
Mhm.
or crunches. Is there a good rule there to follow?
I don't think so. I think it's very dependent on your body. So I would just be checking in. And then if you're unsure, then rope in a pro. So that's why I usually recommend, seeing a pelvic floor PT at some point during your pregnancy to check in. And it's usually if you have no symptoms, no back pain, no nothing, no leaking, and you're just coming in more preventative, then a lot of people come in around the beginning of that third trimester or the middle of the third trimester, sometimes second. Also, being with someone who's a personal trainer who understands all of this can be so helpful throughout your entire pregnancy, because then they're kind of watching out for you. And then it's
Mm-hmm.
also their job to be looking for these cues. So they shouldn't be giving you workouts where, you should be struggling. It's a workout, but you should be able to breathe through it, no doming, that kind of stuff.
Okay, so if we were to take that same theory and apply it to she wants to say hi. The If we can take that theory and apply it to some of the movement patterns that we do in the air, for example, just doing a straddle up, is
Yeah.
it the same thing? Like if you feel good, if you are breathing, if you're not doming, it's kind of hard to say, but would it be the same theory?
Yes, Exactly the
Okay.
same theory. So we just kind of tailor it to whatever your sport is. So if someone's coming in for CrossFit, then we're looking at different types of sit-ups than the traditional sit-ups. An aerialist, I'm looking more at with straight legs. Can you lift those legs up in sitting? Can you do things overhead and hold yourself? So it's just different strategies. And depending on whatever their sport or activity is, then I just ask them, what are your favorite moves or your goals? And then we kind of go from there. But everyone's assessment is slightly different based upon their background.
Okay, I'm thinking about all these other questions now that you're talking. Can you please tell me how the DR and preventing it, maybe, or just not making it worse? And then also the postpartum stage. I just put her on my boob. That's how I'm dealing with this small problem. But the problem is, I'm also trying to wean her.
Oh no.
So it's like, I'll just, it's all for the podcast. It's all to get some work done, you guys.
Whatever you need to do.
Whatever I need to do. So, and she's very happy, as you can tell. Um, my my question is pull-ups.
Yes.
So prenatal, postnatal, DR or not, and pelvic floor. How do they all come together? Because I can imagine, like, you use a lot of abs when you do a pull-up,
Oh yes.
and the entire and all of it. So if you could just speak to that a little bit.
Yeah. So you want to think about exercise or movement patterns from, beginner to expert. And so with physical therapy, what our whole training is on is breaking down every single exercise slash movement pattern and kind of delineating, oh, is this more beginner or is this more expert or somewhere in between. So our whole job is to kind of progress through that and also find ways to make like a beginner exercise harder through different strategies or an expert exercise watered down. So then that way it's still that movement, but not really. So with movements with an aerialist, you'll have to do that breakdown as well about like what's the hardest movement that you have to do. And usually harder movements require a lot of your body or your entire trunk plus your extremities to move at the same time. So you would start with just trunk first. So start with abs first or rigid positions. Can you hold those positions while you move your arms or your legs? Then also, do you have that shoulder strength and lats to like pull down? And then you'd kind of slowly pull those things together. And so in my practice, I have Pilates equipment. So a lot of times you can use like a reformer to practice those movements, but outside of gravity, and then slowly add more and more and more weight to it. And what you're looking for is, those compensations again. Can they breathe through it? Can they activate properly through it? Do they feel good? And then you slowly progress. And then eventually you get them to the gym and they're starting out with, just going up and down the silks. And then slowly adding on movements. But it's all about that breakdown and acknowledging like, oh man, that is a really tough movement. How do I break it down? So yeah.
So would you say if you have DR, is it one of these things where, is it like you shouldn't do pull-ups right away, or do you just need to think about the progression regardless of if you have that gap or not?
Think about the progression, but also figure out where your threshold is. So in my appointments, you're finding out like, where is that line, that threshold where they start to fail. So some people, again, are starting like flat on their back. And then some people are lifting weights starting out. And it also depends on where you are in the healing process too. Are you freshly postpartum? Are you 4 months out? Are you a year out? So a lot of times when it's like a year out or close to, then I will push my patients a lot more. And we kind of just go from there. So there isn't really general exercise that's kind of hands off. It's really what exercises can you do without failure? And then are you slowly adding on more complex or difficult movements?
Okay. All right, separately but not so separately. How does the DR correlate with the feeling of disconnection?
Ah, so this one is, I think, a little bit more personal and psychological, and these horrible ads that are online. Um, but I think with the abs, again, it's going back to your body has had some huge swings in 1 year. And again, it's kind of like puberty. And so your body has a different base of support, it has different center of gravity. So you're going to feel totally off sometimes, especially if you're a high level athlete. You know your body so well. And sometimes for some people, they're kind of stuck feeling their body too much almost. Um, and so our job is to, again, find those thresholds and figure out where you can get more in tune with your body, and with breath work and small activations with easy functional tasks is usually where we start. So, especially with the baby, I need you to do this movement while you pick up your baby. I need you to do this movement while you grab that really heavy, awkward stroller. Um, and so those basic movements at home, you have to do them anyway. So let's do them right. And then we progress from there.
And how many, I guess, out of everybody you've worked with, do you feel like there's a lot of that feeling of disconnection, or is it more of there's just a separation?
Mm, I, th- I think there's, great question. I think there's a huge psychological component, and so many pressures that people feel postpartum and during pregnancy. And there's also this thought process that everything is perfect too. And I felt it myself. I wanted to get back as soon as I could, but like, what's getting back?
Mm-hmm.
So I think a lot of it is really, we really need to start talking about postpartum as if it's a post-op patient. You had surgery, and there's a timeline for healing. And post-op patients, they're not unique in any way on their psyche either. That they don't feel good, and they want to get back as soon as possible as well. So it's not exclusively like a postpartum feeling, but they have that backdrop of saying, well, I had my ACL surgery, so I can't run, and my surgeon told me so, and the research backs that up. And now there's finally some research on return to running, which you could also say return to sport a little bit, but they're finding that you shouldn't be returning to running until about at the earliest 3 months, but usually around 4 to 6 months. And that's mostly because they're acknowledging the healing of the fascia. And
Mm.
so if you want to think about getting back to the aerialist world, that doesn't mean do nothing for 4 to 6 months. It just means maybe your aerialist work um, should be held off for a little bit. And until then, work on those straight leg raises, work on, that core activation with that upper body movement, with body weight, all that good stuff, handstands, like whatever. So, working on those basic movements that make up that beautiful movement in the sky. So, I think we need to change, I think, the how we talk about postpartum and how we talk about bodies, and it's a healing process for sure.
Mm-hmm. Um, and going years out from the pregnancy, let's just say you have DR and you didn't go to physical therapy postpartum. If you
Mm-hmm.
have it still years later, is this something that you can always try to lessen the gap, regardless of how far out you are?
Yeah, so there's one research article that they didn't use an ultrasound, they just used their fingers. Ultrasound is always better, but they found that they didn't change the gap. But that's one research article. And also, it only acknowledges that old school thought of the gap. And it didn't acknowledge the tension across the linea alba. So it's just like saying, how big is your bicep versus how much can you lift?
I
And
see.
for those of us with tiny little arms, um, mine are mostly useless, but especially with aerialists, they usually have such strong upper bodies, but they don't look like, bodybuilders, right? So that gap, is it super important, or is it more about that tension and strength of the core as well? So now if you have like a significant DR where it's like a 4-finger gap, we might have more of a discussion here. But when it's 2 centimeters, maybe 3 centimeters, and you're able to control it, how relevant is the gap versus the strength and the loading, and what can you do with it while doing it well? So I would say we don't have a lot of research to back a lot of stuff up. And then also, we don't have a lot of stuff on that tension, because I think that tension, to measure it, is a little bit subjective right now. We have ultrasound research articles, but I think I have an ultrasound. It's hard to tell like that effort exactly. So I think we need to figure out some parameters there and go from there. But lots of people I know have diastasis recti many, many years out, and also hernias, small ones. And they're running, marathons and doing triathlons and all sorts of crazy things, and they are great and symptom free. So I think it's very much a
Okay.
personal journey, and also like, how strong are you?
I love that answer. Hopefully that will put some people at ease.
Yeah.
And to finish, for the women out there, remember that this is going out to the entire world. So this could be received by women all over the world. And keeping that in mind, who treats this, and how can women find someone who's properly trained regardless of where they live?
Yes. So make sure that you have someone trained up in it. For more medical reasons, I'm leaking, I have pain with intercourse, um, I have low back pain, round ligament pain, all that stuff. Pelvic floor PT is a great, great option. Um, and then for those that are totally symptom free, but they want to keep going on their journey and want to make sure that they check in, or have a full plan for them, pelvic floor PTs, a lot of them do it, and then also some personal trainers. And there's a lot of, I've mentioned it several times now, there's lots of ads out there that I feel like right now anyway are a bit or a lot fear mongering, of like saying the DR is causing everything. But there's some wonderful certifications that are out there now. Not everyone has to have them, but they're a great way of generalizing. There's one by Brianna Battles. She's one that more talks to athletes. It's a little bit more weightlifting, but nonetheless, the principles and philosophies very much apply to aerialists. And also, Girls Gone Strong is a great one for personal trainers too. So you can ask that, but I would just be wary of those that give that fear mongering message of, DR is causing all of these things and it's the worst thing in the world. And, we can fix it and heal it and all that stuff. It happens, and there's definitely ways to nurture your body. But there's some websites for pelvic floor PTs that are pretty easy to find us. It doesn't capture every single person, but it captures a lot, and that's pelvicguru.com, pelvicrehab.com, and then our national organization, apta.org. And so that's a great way to find us.
apta.org, is that correct?
Correct. Yeah.
So the ads that you're talking about, they probably come up for you more than they come up for me, because this is, this is your field, but because, Instagram and Facebook know everything about you. So basically you would say that you're seeing these ads, and people or companies are trying to sell a product. So they're trying to tell you that DR is bad, 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 so that people will
Yes.
buy their product. Is that basically what you're
Oh,
talking about?
yes. There's a lot of that. And there's a lot of people, they have a kid and they become really passionate about pregnancy and postpartum, which I encourage. I think that is amazing. And Carrie, you've done like an amazing job of like doing your research and calling in
Oh,
people
thanks.
and asking opinions. And that is what the spirit should really be all about. Like, get your team. One person doesn't know everything. I don't know everything. I work with a lot of personal trainers out here, and I rely on them to help take care of my patients. And they rely on me for like things that are out of their scope. So we should all really be talking to each other and being more of a team. And um, I think it's wonderful, Carrie, what you're doing. I think it's so cool. So I
Thank you.
commend
And can I tell
you.
you that it took me so long. I know you know this because we've had conversations over many, many months, but it just took me so long of sitting on it to figure out how would I do this while also staying in my lane, because want to I didn't want to do your job. And I feel like a lot of the people who are trying to kind of speak in this platform, you end up having to do other people's job because you're
I,
trying to give
yeah,
advice.
I totally agree. And I have loved that we've had lots of meetings outside of this where you say that exact phrase, like, I want to stay in my lane. And I think that's awesome. I feel like physical therapy, it's the same thing. There's definitely people within our practice where you're like, oh, that's a little outside of your scope. Um, and so, I need nutritionists, I need personal trainers, I need surgeons, I need OBGYN. So, and everyone has their role for sure. And there's some overlap on a lot of them. But I think it's amazing when people can acknowledge that and bring that information to the forefront. I think it's so cool. And you have such great expertise in your field.
Yeah, I'm really excited because I also just talked to a perinatal mood disorder
Oh, it's amazing.
specialist, and we had this whole conversation about it, and I feel like my job is to ask the right questions of all of you guys and to make it really specific to our audience. Like, how does the straddle and DR correlate? And that question, I think, does need a mediary like me. So I'm really excited too, because
Yeah.
like every single time an episode comes out, the first one just came out last week, I just feel like, whoa, people are going to get so much from this guest
Yeah. I
because it's just so
really
specific.
admire your work. I think it's very cool. And I can't, I'm not an aerialist. I've taken aerialist classes, but like that's as far as I've got. I just admire, I fangirl.
I love that you fangirl.
So
And for the listeners, this is just the first episode that April is going to be a part of. I decided to go with DR because it's such a I don't know, a 4-letter word in our community.
it's infamous.
It's a 4-letter word. But then the next one I'll probably go to is pelvic floor healing, because that's such a big topic. April and I have done a webinar in the past, and a lot of our listeners might have gotten to us through that webinar. But I'd like to go there next, and then to a lot of different topics. Painful sex after after the birth is a big question in that
Yeah.
territory. And it's something that like I have a couple students who had babies, I have one student who had a baby, and she basically just grin and bared it through the sex the first year because she thought that there's something wrong, but she didn't know how to address it.
Yeah.
And we talked about it randomly, and she was like, oh my God, I wish I had known that I could have done something about that.
Yeah.
And I've just, that sucks. Like, she didn't have to go through it in that way. So I
No,
really
it's such
hope
a
that
tough tip.
It's a tough one, right? It's tough to talk about. It's tough to get information about it. So we're gonna go there next with April in weeks from now. So thank you so much, April, for being with us today. And we really, I'm really excited to have you back and for the listeners to have this very sports specific information about DR.
Yeah, thank you so much for having me and love this project. This is so awesome.
All right. Thanks, April, and I'll talk to you next time.
All right. Bye.
You can find April on Instagram at mypt2go with the numeral 2, with the number 2 instead of spelled out. And you can always find me at Carrie at wrapyourheadaroundsilks.com via email. I want to thank Asa Watkins, the best baby daddy ever, for his music and audio wizardry. And please rate this podcast at 5 stars and review wherever you get your podcasts, because that's how people will be more able to find me. And thanks for tuning in. I really appreciate you guys being here, and I will see you next time. That's it today for the Expecting Aerialist podcast.